Hello, dear friends. My name is Sofya Dorinskaya. I am a doctor, head of the Medical Information Center. At our center, we provide nutritional deficiency programs. Today, I truly believe we will delve into an incredibly fascinating subject. A topic so interesting, a topic so, on the one hand, close to everyone, on the other hand, unclear to anyone, that I think, after my talk today, many people will have their eyes opened. Have you ever seen in someone else or experienced yourself an enduring and heavy state of unrelenting and persistent depression? Oftentimes, you might not even always recognize it as being a form of depression. A person might think, well, the years go by, life is just like this, youth has passed, and now there's another milestone birthday. Many close friends are unfortunately getting sick. And so this deeply depressive, dreary state of mind is always lingering there in the background for the person. Family, children try in some way to cheer them up. Your husband gives you some gifts, or your wife tries to organize some kind of celebration, but no matter what they do, you come into the kitchen and start noticing that everything is not quite right. This isn't set up properly. The tea isn't brewed right. The dishes are somehow not the way they should be. Or even if everything is fine, the person will still find something wrong. And usually, they speak in this exhausting way, with this kind of tedious, monotonous voice, as if everything is just so bad. And even if your loved ones care about you a lot, they say, listen, stop whining already. We just can't take it anymore. Please, stop whining. And you think, yes, really, what's wrong with me? And somehow you still try. You think, no, what's wrong with me? My mood isn't quite right. I need to cheer myself up somehow. So you try to smile, you watch some movie, and you strain yourself so much just to... Yes, but still in the background you have this feeling, a premonition of something bad. Constant hypochondria is the expectation, like some terrible disease. If you feel a twinge in your heel, it's cancer. If your eye itches, it's cancer. If you get a pimple, it's cancer. If you burp, it's cancer. I don't know. If there's hemorrhoidal blood in your stool, it's cancer. And so that's it. And you are constantly, some people just worry about it, others start running from doctor to doctor. The doctors look at them, find nothing, and say, you need to see a psychiatrist. You open up and say, doctor, I just can't take it anymore. I'm constantly plagued by this depression. So that's it. And of course the psychiatrist says, you belong with us. How are things at home? Yes, you see, everything is fine. I have a wonderful husband, beautiful children, we are quite well off, and we even have a beloved dog. And they give me lovely gifts and all that, but I just can't seem to cope. I just can't. That's all there is to it. You are suffering from endogenous depression. You're actually going crazy. Let's be completely honest here. Yes, you are just completely and utterly depressed. Let's all get treated and start taking antidepressants already. Or nowadays, are anti-epileptic drugs being used for this purpose? Then they might switch you to antipsychotics. Then you start experiencing all the delights, so to speak, of taking these medications, the severe restlessness, the feeling of restless legs, and if the doctor, who isn't a complete idiot, starts switching your antipsychotics, realizing that he's already treated you to the point of tardive dyskinesia, and so on and so forth. All of this happens, and yet your condition still doesn't go away. I'll let you in on a little secret. It simply won't go away on its own, because this is such a deeply rooted and incredibly severe case of depression. These are its absolute signs. Severe endogenous depression. The way a person speaks becomes incredibly repetitive and lacking in any variety. The person constantly lives with a sense of foreboding, a feeling that something bad is going to happen. The person becomes severely hypochondriacal. This depression can It passes periodically, but even during the bright intervals, it is still painted with a depressive background. So, please understand that never, never, absolutely no antidepressants or prescribed antipsychotics will ever truly help you find relief. Because this particular emotional and psychological manifestation clearly serves as a strong indicator that the person is currently suffering from a physical illness due to a significant and chronic deficiency of nicotinic acid. So, in patients suffering from pellagra, these individuals often become quite anxious, deeply suspicious, and their overall mood tends to be extremely unstable and unpredictable. They quickly break into tears. Melancholy, anxiety, self-blame. Self-blame can take different forms nowadays. That she is a bad housekeeper, that she is like this, and that she owes everyone, that she has to help everyone. And this constant appeasement is very burdensome for those around them, even for relatives. You see, you don't even need it, but she or he keeps bringing you things or doing something for you, and you don't need it, but you end up feeling obligated. Sorry, but this isn't just for no reason. The person is experiencing extremely severe physical suffering, extremely severe. And never, never, their facial expressions are dull. And so on. A depressed mood predominates with tearfulness, complaints of melancholy, heaviness in the heart. They don't want to live, speak in a quiet voice, and cry or get agitated every time during a conversation. Attention is weakened, they are easily distracted. Their range of interests is limited to themselves and their illness. They sleep very poorly and little, and their appetite is bad. Do you understand? Let's recall my video. The true illness. Remember, I told you, if you are treating something and it doesn't get better, you're treating the wrong thing. There is such a thing as a true illness. So if you are in this state and you are trying to treat it, even with the constant help of antidepressants, antiepileptics, neuroleptics, and all sorts of other various types of pharmaceutical junk, you will simply never be able to truly achieve anything meaningful in your life. Never and nothing at all. Because the essence of such a person's condition is severe suffering. As a result, this is a special eating disorder, a deficiency of nicotinic acid, and most likely a host of accompanying vitamin deficiencies. Let's take a look together. By the way, it should be noted that pellagra, or a deficiency of nicotinic acid, is one of the causes of obesity and swelling. Let me repeat once again. If you see an overweight person in front of you, you are not looking at someone who has overeaten, who lies on the couch all day and stuffs themselves with red caviar. No. If they really were eating red caviar all day, they would be slim, happy, and satisfied. No. And that's why people who are in this kind of condition. Severe depression. This is severe depression. Nothing can relieve it. Nothing brings the person joy. No shopping trips. None of that matters at all. It doesn't matter what a person's financial situation is, right? They could be given anything, taken anywhere, to any resort, vacation spot, and so on. And still, even if the person seems normal, even if they appear happy, if you ask them, there is always this heavy, inexplicable weight on their heart in the background and a sense of expectation that something bad is bound to happen. Sorry, but that's a sign, a symptom, and nothing more. So usually such people, they start denying themselves food. And of course, if we look at my previous video, the first thing they go for, since these people are preoccupied with the fear of cancer, they're really fixated on this fear, people start to go around and read different websites. And the first thing that catches their eye is that they should stop eating meat. So, if you follow that specific course of action, you'll be taking significant and dangerous strides toward the development of various forms of cancer. You should absolutely never consider denying yourself the consumption of meat. All the more so if you're in such a mental state, you should actually increase the amount of meat you eat. Let's take a look at which specific foods contain the highest amounts of nicotinic acid. Starting off, fresh lamb contains approximately 4 milligrams per 100 grams. Next, standard cuts of beef can have anywhere from 6.4 milligrams, while nutrient-dense beef liver contains about 12 milligrams per 100 grams. Finally, beef brains are found to have between 3.5 to 4.9 milligrams per serving. Veal kidneys contain 9.8 milligrams per 100 grams. Pork contains 6 milligrams per 100 grams. Salmon from 6 to 6.4 milligrams. Veal. If we look at the previous video, yes, if you watch mine, I answered a question from the International Agency for Research on Cancer. They are involved in coordinating, conducting, and so on, research related to cancer, cancer prevention, and so forth. So, they actually do, in fact, do not recommend red meat such as beef, veal, pork, lamb to be consumed. All those things that are necessary to eat in order not to get cancer. This agency does not recommend them. Now tell me, what is on the necks of those experts who write this? Clearly not a head. It feels like it's some kind of cabbage head. So veal contains a lot, as much as 7 milligrams per 100 grams. After that, it's all sorts of nonsense. Dairy products don't even reach 1 milligram. The highest is powdered cow's milk, 0.8 milligrams. Fruits and berries are just pennies. They don't even reach 1 milligram at all. The highest amount is in grapefruit, 0.2 milligrams. Here in cranberries, 0.13. Vegetables, just pennies. They don't even reach 1 milligram at all. In carrots, somehow they calculated 1.5 milligrams. Not that great. Grain products, wheat germ, up to 4.2 milligrams. Well, wheat germ, okay, but how much of it can you actually eat? 100 grams of wheat germ. Can anyone eat that much? At least. And you'll only get 4.2 milligrams of nicotinic acid. And as for all kinds of beans, there are just traces here. Of course. Dried lentils, 3.1. How much? 100 grams of dried lentils. Soak them and see what you end up with. But here are baker's yeast, the wet kind. 11 to 60 milligrams per 100 grams. Well, yeast, yes, yeast actually contains the vitamin. Nicotinic acid is one of the B3 group vitamins, part of the B vitamin group. So, of course, yeast contains the entire B vitamin complex. It's a very good thing. So, there is something very important that I want to share with you. What are the reasons that can lead a person to a deficiency of nicotinic acid? It's actually very interesting. I once read a detailed online post where a young girl was thoroughly describing her close friend. And she was basically describing the entire clinical picture in great detail. She was describing scurvy, describing it exactly as it was, and this poor girl had already been to one doctor, then another, then a third, then a 15th, and nothing was happening. Honestly, I don't really tell anyone on social media anymore because such a fuss gets raised as if I said something terrible. But a long time ago, I wrote a comment saying that your friend actually has scurvy, and she sent me this huge message in response. What is this, my friend? She's such a wealthy lady. She earns so much. How could she possibly have scurvy? To which I replied, well, if you think diagnoses are found in a person's wallet, then of course then it can't be. The presence or absence of certain specific nutritional diseases in a person has absolutely no correlation with their wealth. Unfortunately, that's the reality in today's world. Of course, if we were to take, for example, the Middle Ages, then obviously a beggar living on the street without shoes and who simply walks down the street in a blizzard, and a person who lives in warmth, eats well, and can afford meat, well, of course, that's obvious. But in this modern era, nowadays, individuals possessing significant financial wealth, honestly, I am not going to mention any specific names, but I personally know individuals who are dealing with exactly those kinds of situations. Honestly, even from a purely visual perspective, I know someone from one of the various prominent royal families on the planet who suffers from a very severe case of pellagra. Severe. And judging by the fact that this person keeps appearing with it again and again, their doctors have absolutely no idea about it. Well, anyway, so how can a person develop a deficiency of nicotinic acid? Well, in general, it's trivial. There might not be enough of it in food. Even if he eats meat, that's all, he still doesn't get enough to cover the deficit if it has formed. Unfortunately, if there is a deficiency, it is impossible to simply eliminate the deficiency through nutrition. How can a nicotinic acid deficiency occur? Diarrhea. Previously, it was believed that if diarrhea lasts more than 2 days, for any reason, you are losing weight, you are taking some special pills that expel waste products, you are poisoned by something, well, or for some other reason. But if it lasts more than 2 days, everything is always pellagra. Following. This is a violation of the acidity of gastric juice, a decrease or absence of hydrochloric acid and pepsin in the gastric juice. Big greetings. To all the therapists who prescribe antacids to their patients, it's even scary to say. They are told that they have to take them for life. This is simply a direct road to the grave. This is a direct road to the grave. If you have problems with your gastrointestinal tract, situationally, sometimes you can take something. But if you start taking this on a regular basis, you are simply moving towards it by leaps and bounds. Towards a deficiency of nicotinic acid, towards a deficiency of vitamin C. And even if you take them, there will be no effect at all. Next, any inflammatory diseases of the gastrointestinal tract lead to a deficiency of nicotinic acid. A deficiency of nicotinic acid leads to inflammation of the gastrointestinal tract. We end up with a vicious circle. How do you break out of this circle? You need to contact Sofya Dorinskaya. Go to dorinskaya.com and submit a request for a test and start a program to eliminate deficiencies. We help people get out of this condition. They are given a plan, and we run special programs to gradually introduce a person to the deficiency elimination program and break this vicious circle. Alcohol consumption. The next reason. Wealthy people do not deny themselves alcohol. There is nothing wrong with that. Fine alcohol is one of the true pleasures on earth. But one needs to understand what they are dealing with and know how to manage the side effects that alcohol brings with it. The truth of the matter is, in fact, there is absolutely nothing supernatural about this at all. Again, if you consume alcohol even occasionally on a regular basis, and especially if you've started to notice that you are feeling a strong internal urge or are drawn to drinking, then you should definitely join our deficiency elimination program. Because that's already ding, ding, ding. The alarm is ringing loudly. The alarm is ringing, and it is time to take action immediately. Because these are biological mechanisms, and if you don't know about them, then in fact, you can try to solve the problems they cause forever, endlessly, and never actually solve them. I'll say it again. The definition of a true disease. A true disease is one that is identified, and if you provide, so to speak, the antidote for it, your disease disappears. That's it. If it doesn't disappear, then it's not a true disease, which means you can keep treating it for the rest of your life. And in fact, it will be the very thing that buries you. That's it. So, my friends, I invite you to join the deficiency elimination program. It's always cheaper. It is consistently much more cost-effective than scrambling around later on, trying to address a severe and complex problem that has already developed, which is why proactive measures are so vital. To solve which, you'll have to involve a huge number of specialists, and you will have to involve them. Because even if vitamin deficiencies are at the root of the pathology, if a secondary pathology has developed, it must be treated as a secondary pathology. Do you understand? But the underlying issue is still the vitamin deficiency. It hasn't gone anywhere, and it continues to affect your condition. At that point, it becomes such a tangled mess that you'll really have to work to unravel it. So don't let it get to that point. Otherwise, you'll end up facing serious losses, including financial, emotional, and time-related ones. Take precautions in advance. I invite you to join our deficiency elimination program. Visit the website dorinskaya.com. Right away, you'll see 2 buttons. Test for adults and test for children. Click on the button for the person you want to order the test for. Fill out and submit the order form, and we'll start the program. All the best. Goodbye.